Good afternoon, everyone, and welcome to the Baldrige Foundation's Institute for Performance Excellence webinar, Building a Culture of Performance Excellence Through Team-Based Coaching. As a reminder, due to the high number of participants, everybody will be kept on mute during the presentation. If you have questions, please submit them to the moderator in the Q&A box located on your control screen. Presenters will answer questions during our panel discussion. Recorded version of today's presentation and slides will be available on the Foundation's website early next week. Before we get started today, I want to take a moment and recognize all of our great sponsors and a special thanks to the members of the Mac Baldrige Society who serve as trustees of the Foundation's Institute for Performance Excellence. Here is today's agenda. Today's guests are Dennis Delisle, Executive Director, University and Ross Hart Hospitals, The Ohio State University Wexner Medical Center, and Michael Martin, Associate Executive Director, Ross Hart Hospital and Heart Vascular Center, The Ohio State University Wexner Medical Center. And now, Dennis, I will turn it over to you to get us started.
Well, thank you very much, Jerry, and thank you for all of you who are joining us on the webinar today. I'm excited and grateful for the opportunity to talk through the transformation journey that we are underway at Ohio State. And I'm with my colleague, Mike Martin. And we've had some technical difficulties leading right up to the moment of this webinar starting. So as we go through, we may fumble through some networking issues, but I'm glad that Mike can join me as well. So as we go through today's content, what we want to talk about is how can you develop a strategy that enables you to drive team-based coaching and as a way to really accelerate the transformation of your culture. What we also want to talk about is how do you integrate leadership development as part of the core of what you do as you think about opportunities to drive results within your team, your department, your organization, whatever the context is for you. This applies at all levels, all types of teams, whether you're in healthcare, manufacturing, education. It's really agnostic to the industry, these fundamental philosophies and framework that we're going to be sharing with you today. And hopefully you'll be able to take away some tidbits of what does this mean for me and how can I apply this into my work. We're going to talk a little bit about the organizational overview so you have some context about what we're responsible for. We'll talk about our why behind the work of what we do, and then importantly, the what and the how. And this is really the pragmatic aspect of how we're driving our culture transformation. Lastly, we'll talk about some of the results as well as our plans as we move forward into the future. And then we'll certainly pause and provide the opportunity for questions, comments, etc. from the audience. So again, as Jerry mentioned, I'm Dennis Delisle. I'm the Executive Administrator for the Academic Medical Center University Hospital and our Heart and Vascular Specialty Hospital, of which Mike is the day-to-day operational leader there as well. So Mike and I partner with our clinical colleagues, our physician leaders, nursing leaders, our therapy and support service teams as well to help drive the vision and the mission of our areas of responsibility. A little bit about the Ohio State Wexner Medical Center. So we are an integrated academic medical center. We have 7 hospitals across our system. We also have health science colleges that are also under the umbrella. We're one of the best in the country as it relates to our quality, patient satisfaction, our research agenda as well. We're really proud of the work that we've done over the course of many years to build this reputation both locally, regionally, as well as nationally. For Mike and I, we also have within those 7 hospitals, 2 of the hospitals that we have accountability for, the University Hospital and the Ross Hart Hospital. In these 2 settings, we see amongst the sickest of the sick. So those are patients that might need heart or lung transplantation. They might be on a heart bypass machine. They might have level 1 trauma, getting a major accident and come to us for support. As we think about where we are and where we're headed, importantly, if you look to the image on the right, you can see we are building this new facility that will be up and operational in 3.5 years. We've been working on this project for about 6 years at this point, from when it was a concept on a piece of paper until now. It's actually that entire structure is up and we're just filling in all the details in the middle. we're using this tower as really a visual beacon to say, here is our vision on this campus. And as we think about culture transformation, the intent here along our journey is to arrive as a culture before those doors open. Because a big building like this should reflect the work that happens inside, the inspirational and incredible work of our clinicians, our support service teams, as they help our patients and help the broader community we serve. The building outside of that cultural transformation is simply going to be a very expensive, very shiny new piece of equipment, assets, et cetera, but not help us drive care delivery, help us drive the advancement of research. So really important that the cultural transformation and the work that we talk through today really is a predecessor and foundation for the work of the future once we open the new doors of this building. And I'm gonna be welcoming Mike here alongside me because his office does not have working network, so we're going to be on the fly here and presenting together in my office. When we talk about how do you drive this cultural transformation, how do you develop a team-based approach, we want to start with the why. What is the underlying reason for what we want to do? When we think about our vision, our goal has been, we want to be the best at getting better. Part of that is our continuous improvement mentality, the way in which we get better 1% every day. That becomes the competitive differentiator for us over the course of many months and years. In order to become the best at getting better, what we really have to do is develop a culture of excellence that focuses not just on what we do, but how we do it. And we pull a lot of inspiration from our athletics programs, the football team. We have a lot of great examples of how you invest in talent, how you continuously build a system that leverages your teams, leverages the talent, and really focuses on an integrated team to achieve consistent results year over year. So we use that as a great source of inspiration for the work we want to do with our clinical teams, where our field really is what happens within those four walls of the hospital or in that outpatient clinic. Mike?
Thanks, Dennis. And yeah, thank you, everyone. I didn't get a chance to tell the group that we're very honored to be a part of this webinar series and to be sharing our experiences with you. And coincidentally, one of the core tenets that we talk about in developing a leadership culture is the ability to lead through unanticipated events or crises. And we had one, as Dennis mentioned, just before we signed on for this webinar. We had a network outage, and so it's putting our work to the test here. But very honored to be with you all. So as Dennis mentioned, when we talk about becoming or being the best at getting better, it really starts with understanding who we are as an organization right now and where we're at, and really the gap between where we're at and where we want to be in the future. So I want to highlight and just add a little bit more context to that. First, by talking about some of our challenges as an organization. So we here at the Ohio State University Wexner Medical Center feel our quality is very strong, but we have potential to be exceptional or elite or among the nation's leaders with quality. We often say we certainly, if you were to look across our organization, and I bet this is true of many healthcare institutions, but other large organizations as well, we have high-performing individuals. We have pockets of high-performing teams and smaller groups of teams. What we're trying to do is align all of those teams to a common system of processes, a common focus and approach. So those high-performing and individual teams become high-performing organization. We're a large organization. That often means that we can be inefficient, can be difficult at times to really align and to quickly pivot in, again, relation or in reaction to various environmental, internal and external environmental factors. And then just like any other healthcare institution, we're going through a time right now where we're facing incredible financial pressures. The cost of care delivery, the cost of recruitment, retention of our staff is really soaring. And the ability to drive volumes and revenue to our organization to offset that is really becoming critical. And so we're under quite a bit of financial pressure, just like all other healthcare institutions across the United States. Our aspirations, we already mentioned one, we want to be elite. We want to be among the top 10% nationally in quality performance. We want to become more nimble We want to develop that team of teams model, again, to connect those high-performing individuals and teams to really work together to efficiently become a high-performing organization. We want to, and this is really important to both Dennis and myself and our other leaders personally, we also know it's important to us in terms of achieving our goals. We want to have meaningful employee engagement. We want to connect people to the why, to the mission of our organization, and connect them to their personal why as well. Why are we here at Ohio State? Why are we here in healthcare? And what are we trying to accomplish together? And we also want to be financially resilient, and we want to create a sustainable organization so we can achieve our goals in the future. So we want to talk a little bit about our leadership philosophy, and you're going to learn a little bit more over the next few slides about what we do, how we do it, and again, why we do it as well. So the first thing that we've tried to instill when we've talked about shaping our leadership culture is a team-first mentality, to shift from a me-first mentality to a we mentality. So we talk about that a lot, we before me. It's about what is right versus who is right, and really trying to focus again on our goals rather than the individual behaviors necessarily. When we think about the what and how, you'll hear this common theme in how we've tried to kind of structure ourselves. We believe that the best organizations and strong leaders have this healthy balance of possessing essential management skills, having an operational management toolbox, and core leadership competencies. And you'll see that here on this slide. So the what we do, when Dennis first came to our organization here at Ohio State, he brought with him a significant focus and background and wealth of experience on operational excellence, process improvement. We've really tried to develop not only a culture of process improvement and continuous learning, but also provide our leaders, including myself, with the tools in order to accomplish our goals in that area. The how we do it, then, we like to say we put this all on a platform of leadership development and leadership culture, helping our leaders understand and connect again to our mission, and then building trust within individuals and among individuals and teams.
So I think just one thing to emphasize here is when we think about what you do and how you do it, we consider this a both and proposition. You need to be competent and have the ability and the tool set to continuously improve, but you can't leave bodies in the wake. How you do this work, how you engage frontline staff, how you engage leaders, how you navigate the politics, that matters. So we don't want a bunch of nice people that maybe aren't the right fit for the role, but we also don't want a lot of really highly competent people that aren't fun to work with or that we don't trust. It has to be both and. And I think that's an important thing for us to emphasize as we think about this work is how do we help people not just do the job well for what they're responsible for, but how do they work within teams so they can leverage other skill sets, complementary strengths of others to help all of our teams do better collectively.
So we talked a little bit about the what and the how, and this is not a common or not an uncommon or new concept, but it really starts with our why. We often say common sense, not common practice. And so we've been very, very intentional on trying to bring individuals and groups back to the collective why of our organization. So you can see our mission here at the Ohio State University Wexner Medical Center is to improve health in Ohio and across the world through innovation, research, education, and patient care. So we've been very focused again on aligning all of our leaders, all of our teams, from our executive and senior leadership teams to our frontline teams around the why. Why are we here? And then aligning all of our goals, all of our focuses, all of our strategies and tactics towards that mission. And it's really, we believe, obviously, that first step, and then establishing the what we do to get there and how we get there. The most important, again, is that why.
So we're going to now talk about what is the what and how of team-based coaching. One of the things that Mike mentioned is in order for us to drive this work, we had to define who is the leadership team. And in many organizations, you might think of it simply as what is your organizational structure. But in the way healthcare works, we have physicians, we have nurses and other clinicians like our therapists, pharmacists. We have support service teams as well. And our organizational structure tends to be very functional and therefore siloed. And we recognize that we really need a different model that forces the integration of different disciplines. So the triad model is really about shared ownership across different disciplines, because the way a physician, a nurse, or an administrator will look at a problem is different. And if we look at problems from different angles, we're going to come up with a better holistic approach. And then locally, we think about what is that local operating unit. It might be a nursing unit, it might be a surgical suite, and having dyad ownership, a physician and nurse leader, to own what happens locally: quality, safety, efficiency, patient engagement, staff engagement. When we couple the triad-dyad model, this team of teams approach, rather than functioning simply by the way we define our reporting relationship in the org chart, this is a much more dynamic team of teams approach where we look at opportunities holistically. Again, we share in our decision-making. When we think about, and I can't advance the slide, if we can move the slide forward. When we think about why do we do this, the core here is around alignment, action, and accountability. What we want to make sure is we can align, as Mike said, what is the why? Where are we trying to go? What is our vision and aspiration? And how do we ensure alignment across our different teams? With that alignment comes, what are the clear actions that we need to take? That might be a strategic initiative, a project, a body of work that a department or collection of teams needs to drive forward. What are those actions we take? And then lastly, from an accountability perspective, what training, development, reinforcement, as well as performance management is necessary to enable us to advance these actions in order to achieve our aligned goals? When we think about this model, just using as an example, we have our critical care triad, and they have accountability across our surgical, our medical ICU, our neurocritical ICU. And what they do is they work across these different teams in a horizontal way for staffing challenges and opportunities, for the deployment of evidence-based practice, to ensure that where we find an opportunity in one area, we can share that knowledge and spread it to others. We have a few groups like quality and safety that intentionally go across all of our units, all of our different triad teams, to ensure consistency and standards as it relates to our quality and safety agenda. Next slide, please.
Great. So we're going to spend a few moments here talking about, again, going back to that theme. You've seen our structure and how we're aligned and how we really scale this work. And if I had been able to share in the first couple minutes of the introduction, one thing that I would say is just a little bit of my background. I am a physical therapist by background and spent much of my career as part of our sports enterprise or sports medicine enterprise here at Ohio State, and then overseeing a lot of our clinical shared services. And Dennis gave you a little bit more information about our organization, but I started as a leader with a team of 6, and I'm sure you saw on a previous slide that we've now scaled this work between the two of us to a team of about 6,000 or more. And one of the things that we really strongly believe in is that this work is very scalable. It's really how we deliver these concepts. And so by creating the triad and dyad model and some of these leadership structures, we're able to scale and deliver this work to the front lines as well. And again, going back to what are we doing here? We're trying to develop an individual management toolkit, a set of management or operational leadership competencies, and then individual and team-based leadership competencies. This is not an exhaustive list, but these are some of the things that we've initiated and implemented over the last 2 to 3 years to really accomplish those goals of building a really comprehensive leadership team. So when you think about some of the individual management competencies, we've brought, again, a process improvement, a continuous learning approach here. We've really tried to deliver operational excellence training, including Lean Six Sigma training and education. All of our leaders at some point here across our hospitals go through either white belt, yellow belt, green belt, or even some black belt training. And go through project completion as a part of that training. And the level of training that they get is really aligned with their responsibilities here at Ohio State. And it's been very beneficial to all of our teams, not only obviously to learn that toolkit, but to establish a commonality of language so that we can speak in similar ways and we can really, again, start to connect those various individuals and teams towards our goals. We have programs such as a Know Your Numbers initiative. So teaching our leaders, particularly at the individual level, at the individual unit or business unit cost center level, how to really understand their business, not just the clinical portion of their enterprise, but understanding funds flow, understanding the life cycle, for instance, of a claim in the revenue cycle, understanding the life cycle of a supply, understanding which levers you can pull operationally that have impact, either negative or positive, on your team. And knowing your numbers is not only acutely knowing your business, but being able to benchmark that against other external best practice or aspirational organizations. So it's been quite a beneficial and positive experience for our teams. Examples of some of our individual leadership competencies, we have something called a leader-learner conference. If you're with a healthcare institution, this might be, again, common to you, but it's very common for many of our leaders who are clinical to become more senior leaders in an operational or administrative space. If you're a clinical leader like myself initially, it's very common for you to have a clinical case conference where you discuss complex clinical presentations, the decisions that you made to address that patient's case, and ask each other questions, challenge each other, seek advice on how they may have treated that individual patient a little differently to ensure, optimal patient outcomes. Well, we took that right to the operational administrative world and the culture shaping world and have leader learner conferences where we have a leader share an experience, for instance, on how to build trust with the team and the decisions that they made to try to build trust, where they went wrong, where they had successes, where they had opportunities, and we work together. We do leadership rounding where all of our leaders spend time on our individual units to learn more about the experiences of our frontline employees, to seek feedback and to be more present in the work, not only the teams they lead, but teams that others lead, just to, again, establish those relationships. Individual mentorship programs as well. And then what we'll spend the bulk of our next few moments on is really the highlight of our presentation today, our team-based leadership and culture shaping competencies. We wanted to take those teams, those individuals who may typically work, not one of our favorite phrases, but in silos or more vertically within our organization, and get them in the same room and develop a common leadership culture and a common set of relationships and goals to really build our competency collectively as an organization. Next slide, please.
One thing before we move forward that I just want to emphasize here with that leader learner conference, what we've targeted, as Mike is going to then share the framework of the coaching approach. What's important to note here is when we ask leaders, and Mike and I have done this, we've had our CMOs do this. What we've asked people to do is bring forward a case when you failed. What did you do in a scenario as a new leader, as a seasoned leader, a new team, your experienced team? Talk about a scenario in which you had a good intention and you failed miserably. And what are those learnings that you had? And that's important because as we begin talking through this framework of how we create the space to talk about leadership, that vulnerability and that safe space to talk about what's real, not rosy colored glasses, everything is fine, but rather the real work of driving culture change, the real work of driving process and quality improvement. It's not easy, and we often fail frequently. And what we're trying to instill as we have these types of discussions is you can fail, but you cannot fail and not learn from it and grow from it. So it is important to try. It's important when you can't succeed the first time, which often doesn't happen. You're often not successful your first attempt, your first several attempts. How do we learn from that? And creating the space, having our leaders go first to say, we failed many times, and we're here to still live to tell the next story. It's a really important entree into how we begin having meaningful dialogue with our leaders and teams. Next slide, please.
So as Dennis mentioned, we wanted to establish a framework upon which we would deliver this team-based leadership coaching, culture shaping, this competency development. So we chose Patrick Lencioni's 5 dysfunctions of a team concept. You can choose, honestly, if you walk away from this presentation and decide to implement something like this, you can really choose any number of frameworks. You can build it on your organization's values. You can build it around specific goals or mission. There are many other interpersonal, emotional intelligence, leadership competency frameworks. We happen to choose the 5 dysfunctions of a team. So a quick background, as you can see here, the 5 dysfunctions of a team, and some people you like to refer to it not as dysfunctions, but certainly either functions or core attributes that are either present or absent in every team or group of individuals working towards a common goal, which really determine that team's potential for success or potential for failure, to be honest. Those 5, as you can see on the screen, things like absence of trust, fear of conflict, lack of commitment, avoidance of accountability, and attention or inattention to results. If you have trust on a team, it lends itself to more positive results and more positive outcomes. If you lack trust on a team, it's difficult to build upon that foundation to achieve your results, to hold each other accountable, to have healthy, constructive conflict versus destructive conflict. So we really believed in this framework and felt that it was something that we could really easily build on. So why did we choose it? Again, as I just said, we believe in it. And one of the things that hopefully you'll gather, if we didn't say it explicitly up until this moment, is, there's obviously a professional benefit to this. But I know our leaders, Dennis and myself, and our other leaders here at Ohio State firmly believe there's a benefit overall. There's no other way to say this. There's a human benefit, a benefit to life, to growing in this area as a leader and interpersonally. So we felt like these are just good skills that you could take even beyond the workplace. But even, more importantly to our work, we know we spend so much of our life here at work. We wanted to develop and grow as individuals and help our leaders grow as individuals too. So we both very firmly believe in this framework. Number 2, it's very simple. It's easy to implement. It's easy to repeat. You can grow over time through this framework, and it's very easy to scale. And again, as you see there, it really shapes a series of discussions, not only throughout our year, but years upon years, you can really build upon this. So you build on a framework of trust. You ultimately will work your way through those other functions or dysfunctions, ultimately leading to results. Next slide. So quickly on how we did this, what we wanted to do, recognizing that all of our leaders have many obligations and are quite busy, we wanted to limit the amount of what we would call homework. We wanted to focus very practically on tangible work, tangible application, meaningful discussions that relate directly to our work. So what we would do is assign a monthly TED Talk or some other, what I'd call an inspirational video, usually about 10 to 15 minutes in length, sometimes shorter, sometimes a little bit longer. We would assign it to our various leadership teams. Then we would get together once a month, and we still do this, about 90 minutes each month. And we actually have small group breakout sessions. We did this virtually because we instituted this initially during the height of the COVID pandemic. And now that we're able to start meeting in person, we actually do this in person as well. It's been successful in both platforms. Certainly we love in person, but our virtual platform has been successful as well. We meet for 90 minutes. We have small group discussions with some facilitated questions around that video. And then we get the entire group together, debrief on what was shared in those small groups as well. We also then not only want to develop, obviously, that large group leadership and relationship competency, but we assign randomly 2 leaders to meet on a monthly or bi-monthly basis. We call it in our organization getting beyond the badge, to know a little bit more about each other, our professional lives and backgrounds, our values, our personal lives as people are comfortable sharing. And we essentially have a cup of coffee together and really get to know each other on a more personal and a deeper level beyond just our titles or our professional interactions. As you can see there, we're really trying to shift to a relationship-based, trust-based culture versus simply a vending machine or transactional culture, which is often present in large organizations.
If you move to the next slide, what we want to talk through is, what does this actually look like? So as Mike described, we use that framework of the 5 dysfunctions. And every month, what we did, so if you look at the top left of July, what we did in the first month of the program was we introduced that framework of the 5 dysfunctions. And as you see in August, we then started to talk about psychological safety. And then in September, we started talking about, how do you build trust? How do good leaders make you feel safe? How do we think about trust versus performance? And then we start moving into, how do we deal with conflict? How do we make sure we have the space to agree, the space to disagree? And as Mike said, we want to have a dynamic with our leaders where we can attack the idea, not the individual. And when we think about programming for this leader development every single month, we're very intentional about what video is going to help bring forward concepts or the right dialogue that enables our teams in the small group setting. And we think this is important. When you have people in groups of 3 to 5, it's hard to not contribute. You can hide in plain sight in a large group meeting, certainly in a virtual meeting, but it's really hard in a 3-person, 4-person small group where people are asked to share from their own experience. We also find it's much more meaningful for the individuals, as we surveyed, because they are not just listening, they're actually contributing and they're adding their own opinions. Now, Mike and I had the opportunity a while back to do a presentation at a conference, and we actually took the audience and we took 10 minutes and asked the audience, we gave them a prompt and a question, and we asked the audience, pick a person to your left, to your right, have a conversation, and then we're going to do a debrief. And what was really interesting is we didn't give them the video. We didn't give them a transcript of the narrative of that video. We gave them one question. The one question we gave in that session was, what aspect or quality of the best leader you worked for spoke to why they were so successful? That was it. What made the best leader you ever worked for successful? And we had people talk about it. And it was in that one simple question, we had about 15 minutes of incredible dialogue about the things that work really well with leaders, the gaps or challenges or blind spots others might have. And from there, this is where we'd facilitate dialogue to say, well, how does that play out in your work? How does that play out in your team? How did that work last Tuesday when we had a meeting and I didn't see what you just said you tend to do? So it not only in that setting, creating the opportunity for that kind of dialogue, but importantly, when we leave that room, and until the next time we're back together, it's giving us the language, the tools, the ability to help each other. Hey, we talked about how to disagree productively, how to have, safe conflict, attack the idea, not the person. But in that meeting, it felt like you were attacking me, or I may have observed that what you were saying to another individual felt more attacking of them versus how do we help figure out what to do with this problem. So it gives us the ability as well to coach in the moment when we're not in this particular setting, which I think is really important. The work we do here is not just about in a room. It's about what do we do leading into in that room, and what do we do when we're leaving that room in between the next opportunity that we get together. I think importantly as well, it's the growth through that reflection and sharing of our own experiences individually. And then as we get into a large group and start sharing our thoughts, our observations, our reflections, that's where we start to see a lot of individual growth. And as Mike described, when we do this in small groups as well, you start to see the formation of much stronger relationships where people begin, in the words they use, the way that they approach the work, they are much more caring and focused about how can I help you, not why are you asking for my help when my department doesn't have a transactional relationship to yours. So it fundamentally changes the way we approach each other, which is how can I help? I'm going to be more curious than judgmental, and I'm going to engage in the work we do collaboratively as a team. So you might be wondering, well, this is great. Like, what have you seen as a result? So if we can go to the next 2 slides. So in terms of our results, you can move forward one more, please. As a baseline, the first thing we wanted to do, we took this survey that comes from the research from Patrick Lencioni. And it's essentially a team assessment of the dysfunctions. There's a mix of different questions. People will rate, usually, sometimes, or rarely as it relates to a particular question. For example, team members are slow to seek credit, but quick to point out the faults of others. Does that happen always? Is it rare? And we divided this into two groups: our senior leaders, which we call the Leadership Council, and our Directors Council. And we did a baseline. And anything that is essentially a 5 or lower is considered low functioning. Anything that is between a 6 and a 7 is considered moderate or medium functioning. So when you see the baseline here, what you find is across the board of those 5 different elements of the dysfunctions of a team, or the components of high performing teams, for both our senior leaders as well as our directors, that we were underperforming. You may also notice there's almost a year in between the two groups with their baseline assessment, and that's because we started with the senior team in October of 20. And as we started to see progress and a lot of improvement with the way we're working, we realized we need to deploy this to the next group. And Mike will talk through as well, when we talk about the subsequent years of our journey, how we're applying this approach in many different ways. If you move forward to the next slide, when we look at from the baseline to what has happened since. So for the senior leaders here, you can see a 2-year span between when we did our baseline to our most recent. And then you see about a year plus for our directors. And what's really encouraging is the majority of these metrics are moving in the favorable direction. What's interesting is you see the first 3 elements: trust, conflict, and commitment, clearly making a difference. And in part, what we believe is just getting people in the room to say, you are the leaders, here is the team. That alone was powerful. Because again, when we think of our organizational structure, we're not in the same room, seldom, all together. So we said, you are the leaders. Now, as we start talking through how we drive healthy conflict, how we commit to common goals, what we started to see is over time, you see these opportunities for improvement, accountability, and results. You start to see people are providing feedback. I am buying into what we're doing. However, we don't have consistency across our leaders. We don't have consistency across other teams and areas where we might have responsibility for. And this is as we continue to get feedback from our leaders. We also use employee engagement surveys. We use obviously our operational KPIs and other metrics to track our performance that helps inform how are we doing as a leadership team. If you go to the next slide, you'll see it's not just the scoring, but rather verbatim comments as well. And what's interesting is when we say, what is feeling positive about this work? You get better alignment, better connection. As Mike described, we're connecting people. We're a people-based business. We're people who care for other people in need. We're creating teamwork, less silos, more collaboration. What you see, what's interesting is what needs to change. You start to see, well, we're not aligned everywhere. So we're better aligned, but now we're starting to see pockets where we're not consistent. We see this commitment to continuous improvement, but do we have the courage to do the hard things? Do we have the stomach to deal with those long-standing problems, those sacred cows, the elephant in the room, whatever analogy you use? Do we have the courage to actually affect change? Or are we just saying what sounds good? We have leaders that don't display the right behaviors that we're trying to endorse consistently. So not all is good, right? There's opportunity. There's opportunity for improvement always. And it's this important feedback. We don't just ask for the survey, get this feedback, and then talk about it in a dark room somewhere. We bring this back to the team and say, let's talk more about this. Let's talk about where we're concerned. Let's talk about what we need to do to focus. Let's talk about what has to change and what are we going to commit to in order to be part of that change. And it's been a very bi-directional and dynamic discussion over the course of these last 2.5 years, where we are rolling our sleeves up with our leaders, getting into the weeds of the work and feedback, and continuously circling back to make sure that as we have these leadership development programs, as we're leading these team-based coaching discussions, that it's relevant, it's applicable, and that we're actually making meaningful change as we move forward with our strategic agenda. Next slide, please.
So we want to talk about how we've progressed in just our last few moments here and where we're going next. But one thing that I would add with regards to the measurement of our results, what you saw there obviously are some self-reported results around that framework of the 5 dysfunctions of a team. But I think one of the added benefits that was not on these slides that we have actually seen, and we have those self-reported results for any number of councils that we've now implemented this on, but it's also lent itself to much easier conversations about accountability beyond the context of this leadership team-based approach. So we can talk about relationships and trust and accountability, but as you see here, the idea is that we're cascading this to the teams beyond just these leadership committees or councils or groups that we've implemented this with. And at a minimum of every 6 months, we actually do a self-inventory beyond just how are we growing as a team and say, this is great. And it's easy that we can come together and talk about trust amongst leaders and fear of conflict or avoidance of accountability. But what evidence do you have on your team that this is working with regards to translation of performance? We've had some very strong and positive guided discussions, feedback sessions about how are we translating this, what we call paper into practice? How are we translating what we're learning into true actionable outcomes and strategies and outcomes in our teams and across our organization? And it's been very easy then to have a conversation about accountability in this context. So you can see our progression over the last 3 years, and this is essentially, it doesn't certainly have to be year over year. This could be, weeks or months, but this is how we've kind of cascaded it. Year 1 was simply introducing this format, introducing the framework, beginning to talk about core themes, establishing our new structure in the triad and dyad model, building that team of teams model. We really focused, as Dennis mentioned earlier, on the senior leadership level. Year 2, we continued with the senior leader level, and we began to implement this at the director level in our organization, both clinical directors and operational or administrative directors.
Can I make a quick comment
Sure.
about that? Just for this group so they understand as well. We will meet on the first Thursday of the month with our senior leaders, and then 2 weeks later, we'll meet with the directors, and it's the same content that month. So the month of February, as an example, as we're planning for this, they get the same video, the same discussion questions. What happens in the room is different because you have different people, but it's intentionally the same content because then it reinforces what the senior leader, what we're talking about in that group, and as well as what we're talking about with the directors. So this is not separate information. They're not learning different tools. It's the same topic, the same content in that same month. So we can really carry that forward together. So it feels integrated, even though they might do this in separate rooms.
Thanks, Dennis. And as you can see, then the last year, we believe, and I think there's good evidence, both internal and external to our organization, that when you talk about employee engagement, employee performance, the local leader, the direct manager of the employee, is the most critical individual in terms of enhancing the employee experience, getting employees engaged, and really aligning them towards optimal performance. And so as we go along, we're trying to scale this closer and closer to our frontline leaders. And you can go to the next slide, and we can talk a little bit more about what our next steps are. So how do we scale this? Not only to the 6,000 employees in our hospital, but the 23,000 plus employees across our medical center. Number one, we've actually now been able to hire dedicated resources to partner with Dennis, myself, other executive leaders to help us basically build a framework where we can essentially train the trainer, establish a core group of leaders who help facilitate this work. We do think it's very important that senior leaders are close to this work and involved and are living out what they preach, essentially, but we need more resources, and we've been able to do that. We also want to move to being able to scale this to our medical center across the whole system, our university, and even beyond the walls of our university. So we're in the early stages of really building a much more significant development platform, again, establishing those essential management tools and core leadership competencies, and you can see some of those examples there. We'll turn it over to Dennis for our last slide.
So before we open for questions, what we wanted to close here is first this concept around teamwork. And I think in partnering with Mike on this journey, one thing has been clear from our perspective. We do approach the work from a team perspective. Healthcare is incredibly complex, and it requires the work of so many team members for things to work well and to ensure quality and safety is first and foremost. So we really invest in that messaging around team first. We believe that when you invest in your people, when you develop your leaders, everything that matters will follow as it relates to key metrics, your financial outcomes, et cetera. When we talk about our aspirations to be amongst the best in the country, we believe it's this development around our teams and around our leaders that's going to be foundational as part of that journey. We think that culture change, you can accelerate it if you're intentional about what you do, you have a long-term view, but then you also have that consistency and diligence on a daily and weekly basis to ensure, as we talk through how we drive, I've used the example of how we can create healthy dialogue and disagreement. Well, we have many opportunities in meetings, and we'll probably have a few more opportunities this afternoon in other meetings where we're going to have conflict. Are we acting in a way that we are trying to promote? Are we being consistent in our day-to-day interactions? And I think that's important, is to make sure, as you think of that long view, how am I contributing and owning my impact as a leader today in every interaction that I have? We think it's important as well. Ohio State is a large university. It's a large health system. You may not be part of a large organization with resources or other experts you could tap into readily. Keep it simple. We use publicly available information. We use very simple, short TED Talks simply as a way to prompt interesting dialogue. It was the dialogue that mattered. It was not the content. It was not, having 30 different questions for people to ask. I think one of the most important things was getting people in a room, forcing them to look at each other in the eyes and talk about their lived experience. That alone can fundamentally change the dynamics of a team. It does not need to be overly robust, overly complicated. I think the last thing that we'd want to emphasize is, as a leader, you do have to be brave and you have to be vulnerable. And I think it's a both and. I think being brave is being vulnerable. Being vulnerable is being brave. And when you lead by going first, you make it easy for others to then also get out of their comfort zone, talk about what's real. And when you start talking about what's real, that's where growth happens. That's where improvements begin making the difference over the course of time. So we wanted to close there. I know we have a variety of questions and comments in the chat as well. So I'll hand back to Jerry for next steps.
All right, thanks, guys. For everybody still on, we have more questions than we have time. So after this is over, we'll get those questions to Dennis and to Michael, and they will respond directly to you. Let me see. This is from Paul. Has Wexner Medical Center begun to use the Baldrige framework as an overall method to align all of these tactics to drive their goal of high performance?
Great question. What I would offer is, the answer is, for the work that we do here within our university hospital and the Ross Hart Hospital, the answer is yes. But if you were to ask other leaders or even staff if we do that, they would say, what are you talking about? I've never heard of that. And that's intentional. We have a leadership system that takes our cascade of our multi-year strategy. We build that into our one-year operating plan areas of focus, which informs our operating capital budget. We use that to define our scorecard, our key projects, our annual goals from an organization, hospital, department, leader, frontline staff perspective. And we use our performance, our progress, our long-term vision as a way to develop our competencies, our talent, as we continue to evolve as an organization. So the way that we do our work is very much rooted in Baldrige. And part of my background, I spent the early parts of my career leading a performance excellence program. I was a trained Baldrige examiner at the Pennsylvania state level. I wrote many applications. And It's embedded in the way that I lead. It's something that, as Mike and I have partnered together, that becomes an integral framework. But we think what's most important is not the branding of it, but rather how it gets executed and realized in the real world setting. So it's a yes with a caveat as it relates to how we explicitly use that leadership system.
The next question is from James. Is the training interdisciplinary? What is the cadence of the training?
Yeah, absolutely. And that was very critical to us. I would say it's certainly interdisciplinary and interprofessional. So first, when we talk about our structure, as Dennis mentioned, the triad leadership structure, our triad leaders are essentially a senior physician leader, a senior nursing leader, and a senior administrator who may or may not have clinical oversight as well. And so even our structure is built to be interdisciplinary, interprofessional in the sense that we have clinical leaders of all disciplines, whether those are specialty areas or specific professional clinical disciplines. And we also have non-clinical leaders all together and bringing their own, perceptions, experiences, background, leadership competencies to that. With regards to cadence, the team-based coaching is done monthly. So it is a 90-minute monthly in-person meeting with a small amount of to-do in between. Again, usually a 10 to 15-minute video, and hopefully they're contemplating and thinking about that video and some facilitated questions in between. There are some more things that we do in between those monthly meetings, but that's really the core of what we do.
The next one's from Deborah. How do you choose your TED Talk videos? Do you have a specific resource or look for material that makes your point?
Great. Well, it's a mix. It started off with a small group of individuals. We have an administrative fellow and a former administrative fellow who's part of our operational team, Mike and myself, and we had a HR consultant in organizational development. And we essentially set out, here are the 5 categories, the 5 dysfunctions, peruse the TED Talks and come up with what you think are going to be helpful. And then we shared with each other and we pulled out what kinds of questions could you ask as a result of that video? Is it impactful? Is it interesting? And we did a kind of informal assessment with this small planning group, which maybe is 5 individuals. And what we did was we mapped out over the course of 12 months, first 2 months around trust, the next 2 months around conflict, et cetera. And we ended up building it in that way. The second year, very similar process, though what was interesting is as the year unfolded, leaders started sharing, hey, have you ever seen this video? Check out this that I saw on YouTube or this new TED Talk. And then what we do is figure out how can we weave this into the next year, because that also gives people this sense of ownership and authorship in the process. So it's been very open, and if you guys have any great suggestions, we'd be happy to look at those as well. Anything you'd add?
No, I think Dennis said it well. What I would say is even though we try to plan a year ahead, we try to be very nimble in keeping with the some of the outcomes that we're trying to achieve here. We're constantly, I was just looking at our content for not this month, but next month and searching for new videos just to ensure that we have the best content in terms of what we're trying to achieve. And then we share that amongst ourselves and our small leadership kind of planning committee to make sure that we're staying relevant and there's no new content that might be better to support what we do. But as Dennis said, it's really about the dialogue. It's very easy to plug a TED Talk video in there.
Thank you. I think we have time for 2 more. This one's from Joshua. Did you collect data of how many leaders took up the monthly challenges and or correlate staff engagement scores of the leaders who did those challenges with their teams?
Great. We did not. That's a great question. Part of what we've talked through is how do we make those challenges more meaningful and actionable, and then to your question, measurable. So what we're talking about as we're planning for our fiscal year begins in July. So we've established our programming through the end of this fiscal year. What we're talking about as we're planning for the next fiscal year is how are we connecting the dots along our leadership calendar. So for example, when we do our annual goal cascade, setting up the goals for the next year, how are we making the dialogue and the pre-work or the homework aligned to what's happening in that month or in the preceding months or the following months of our leadership calendar, so we can create responsibilities, create deliverables that contribute to the work of the organization. So it's not in addition to, but rather as a part of. We can create the space to talk through how we do goal cascade, how we do performance management, as we then move into, mid-year performance reviews or beginning of the year goal setting. So certainly something that we look towards is how do we continue to make that challenge, the application of what we talk through, much more meaningful.
Yeah, one quick thing to add, I think we do, so participation is an expectation, and not from a punitive standpoint, but from an encouragement, and I'd call it an exhortation, standpoint. So we do track participation in our two, what we'd say are our mandatory initiatives, the team-based coaching and our leadership rounding. We do track that, and then we do track our employee engagement, and we'll specifically relate it to that. We actually have a system-wide employee engagement survey that'll come out in the next 2 weeks, and we will be able to analyze that against participation, but not to the specific whether they went through the leadership challenges, et cetera.
All right, last question is from John. Do you plan to add dyadic or team or group coaching into the mix?
You want to take that?
Sure. Yes, I think both individual and team and group coaching. So, we do, what I'd say broadly is we consider this to some degree a team-based coaching experience, but we have brought on some of those dedicated resources, as we mentioned. And as those next steps of developing that more robust institute or platform, we do have both individual and team-based coaching that we will implement as part of that. And I think there's coaching for improved performance, there's coaching to leverage strong performance, and we've discussed kind of different pathways for that. I don't know if you want to add anything there.
No, that's great.
Dennis and Michael, thank you once again for such an engaging and informative discussion. And a reminder, anybody who asked a question, we will get those to Dennis and Michael, and they will get you the answers as best they can. As a reminder for everyone, the Foundation's Institute for Performance Excellence has numerous training and professional development certification opportunities offered online and at your own pace. This month, we are showcasing again 2 of our most popular online courses, Supply Chain Management and Lean Healthcare Professional. Our Mastering Strategy in Healthcare Bootcamp, which is presented along with LBL Strategies in the George Washington University, is coming up over the next few months. You can visit the Institute website at baldrigeinstitute.org/education to learn more and to register. Thanks to everyone for attending today. As a reminder, the recorded version of today's presentation and slides will be available on the Foundation's website early next week. And once again, thanks to all of our sponsors, especially the members of the Mac Baldrige Society, who are the trustees of the Institute for Performance Excellence. It is their generous support that makes presentations like these possible today. Please be safe and have a great day, everyone.